Hi, this is Dr. Paul Inselman from Inselman Coaching with news that you can use. It is October 3rd, 2013, and as I record this, the government is in a 3-day shutdown, and Obamacare went into play on October 1st for the government exchanges to open 2 days ago. That has been a debacle to date because the government servers have crashed and people are unable to sign up for their health care at this point in time. What I did was I called my personal carrier, who is Blue Cross Blue Shield of Florida. And I want to tell you of my personal experience and then how it will or could translate into your practice on Main Street wherever you are. It does not matter if you are a physical therapist, a chiropractor, medical doctor, any healthcare provider is going to be affected. So this is my personal situation. I am insured for my family of four by Blue Cross Blue Shield of Florida. I pay $850 a month for coverage that includes a $10,000 deductible, and it doesn't matter if one person or a total of the family meet that 10,000. Once it is met, I am covered at 100%. It is an HSA plan. My present coverage is under my group, and I checked out what happens to my group come 2014. And they told me that my insurance is going to go up from $850 to approximately $3,500. They were not sure yet. They would have the actual fees somewhere around November 1st. I said, why is the fee going up so high? And they said they're trying to force small groups out of insuring people and force people into either the government individual policies or the individual policies that will be underwritten by the insurance companies, whether it's Aetna, Cigna, Blue Cross Blue Shield, whatever. So the way it works is this. The government is contracted with the major insurance companies, the Aetnas, the Cignas, the Blue Cross, the Blue Shields. And these companies can do one of two things. They could put you into in my example, a Blue Cross Blue Shield policy that is a government plan, which means that my doctors will be paid by the government, or they could put me into an identical policy that is a Blue Cross Blue Shield plan that my doctors will be paid by Blue Cross Blue Shield. What are the differences? Well, number one, my present policy of $850 a month will change. I will have a deductible of $6,250, and my premium will go from $850 to, are you ready for this? $1,600 a month. I'm not happy about that either. So the way it works is this. If I choose to go under the Blue Cross Blue Shield government-sponsored plan, I will pay a slightly lower fee, somewhere around $1,500, and my doctors will be paid by the government. Or I can go into the Blue Cross Blue Shield plan underwritten by Blue Cross Blue Shield, and Blue Cross Blue Shield will pay my doctors, and I will pay a slightly higher fee, around the $1,600 mark. What is the difference, and why should you choose one over the other? Well, many doctors have stated that they do not want to be paid by the government. Therefore, they're not going to accept government-sponsored plans. They will only accept private insurance. So probably for year one, I will opt to go into the Blue Cross Blue Shield sponsored plan just to see how things play out. Now let's look at the math. 1 out of 6 people right now are on food stamps. 1 out of 6. 93% of our economy, according to the statistics, are feeling a big pinch in the economy. People are one paycheck away from losing their homes. People feel their jobs are not secure. 7% of the population is doing all of the spending. They're the ones that are buying the cars and buying the houses and buying TVs, and our economy is a spend economy. Now, let me ask you, if I have to pay $9,600 more a year, do you think that I feel richer or poorer? I agree with you. I feel poorer. And a lot of the economy is based on psychology. So if I feel poorer, do you think that I'm going to spend more or spend less? Obviously, spend less. If I feel poorer and I am a small business, do you think I'm going to hire people or fire people? I'll probably end up firing people, or at least putting a hiring freeze in place. What does this mean for the practitioner on Main Street? This means that there's going to be fierce competition, not with the doctor or the health practitioner down the street, but competition of, do I pay $4 a gallon of gasoline or do I utilize your services? What the doctor on Main Street needs to know and understand is that deductibles are going to be, as a norm, around $2,500, and copays are going to be somewhere between $65 and $85. I was happy to see that my policy gave me 24 visits of chiropractic care. However, with a $6,250 deductible, I don't think that I will be able to enjoy those benefits. And that leaves every practitioner to be basically running a cash-oriented practice. So these are the steps that you need to do right now to position your practice for Obamacare. We've been working with our clients over the last 22 months to position them accordingly. Step number one, you must create a plan and you must stick to the plan. Ask yourself this question: are my actions bringing me further or closer to my goals? If my actions are bringing me closer to my goals, then continue doing them. If my actions are bringing me further from my goals, cease immediately. Number two, you must create cash-orientated services that your patients will be willing to pay for. Things that patients are always going to be willing to pay for, and I'm not saying that you should do these things, I'm just throwing these out as examples. People are always going to pay for weight loss. People are always going to be paying for health and beauty things. What are you doing in your practice that a patient will be willing to pay out of pocket for? We must create cash-orientated niches or cash-orientated services in order to thrive in the upcoming Obamacare scenario. Next, you must create value on each and every one of your visits. It starts with the consultation. If you're not doing a proper consultation and report of findings, you've got a problem right from the get-go. So please take the time to learn how to master these skills. My name is Dr. Paul Inselman. If you need or want more information, you can call me at 1-888-201-0567, and we will teach you how to position your practice for Obamacare. I want to thank you for joining this episode of News That You Can Use, and we will continue these discussions in further episodes. For now, have a great day and get lots of sick patients well. Thanks for joining.